First, let the record show that Manager Sam Hutchins is absent. First would be the minutes of the November 1 and November 15 meeting. I have read the minutes. I did not see any corrections or changes. You guys see any?
None of it. I'll make a motion.
Motion to approve by Keith Metcalf, second by Jeff Lear. All approved, say aye.
Aye.
Disapprove? Motion will carry. Next would be your bills list and your transfers. There was a bills list and additional bills list. Notice some annual payments to the fire departments for their training subsidy. Every year we contribute to those fire departments. A large quantity of salt came in the garage.
Recreation to City of Bloomfield.
Entertain motion to approve the bills and transfers.
Motion to pay the bill as presented.
The transfers. A motion by Bernard Ice, second by Jeff Lear. All approved, say aye.
Aye.
Disapprove? Motion will carry. First on the regular order of business is over the last several weeks or months, we've discussed the possibility of a resolution for a needle exchange from the Nelson County Health Department. Was able to provide you a clean copy of that resolution with the statistics for Nelson County included. Thank you, Sarah, for those statistics. Bear in mind, those stats are for populations of per 100,000. And that's I guess that's the general standard that the health departments use all over the state, maybe the country probably. That way everybody's on the same level playing field. It is my recommendation to the fiscal court to approve the resolution. But I would entertain a motion and we'll get questions once we get on the floor. Motion by Jerry Hahn to approve. To a second. Second by Bernard Ice. Discussion. I know you had some discussion.
On these statistics, you're quoting crude rates. What is the definition of a crude rate?
It's applying it to a population, kind of what Judge Watt was talking about, so that you're comparing apples to apples. If you just do it by population, like if you just did the number of cases, in very small counties, it doesn't provide for enough confidentiality. So it is a apples to apples comparison, basically.
Is that a
Standard.
It's basically a standard when you're doing statistics.
Is that rate? Is that the rate of existing cases in Nelson County or new cases per year?
That's existing cases currently. But we do estimate that that's probably a lower number than what you actually have because Kentucky traditionally hasn't done a very good job of testing
And reporting.
and reporting.
People with a lot of these diseases those purposely do not report.
So we estimate
And
that
we
it's
could have
very
to
high.
jail pretty regular, don't you, Dorothy, sometimes?
Yes.
So, Sergio, this estimate you got, is that for the state of Kentucky? Or is that for the 7 districts that's in your Lincoln Healthcare too?
When we look at the hepatitis, you're on the fourth paragraph there. When we look at the 8.9 per 100,000, that is Nelson County only statistics. When you look-
8.9?
The state rate is the 4.0 and the national rate is the 0.7. So that shows that in Nelson County in 2014, which is some of the most recent data we have, Nelson County's was much higher than both the state and the national rate.
But now, I guess on that 8.9, it's technically 4.5 people, or a population a little less than 50.
Cut us in half, yeah.
Yeah.
Yeah, because it's based on 100,000.
That's what I asked. It just surprised me. I would have thought it was a little higher.
But you understand the reporting.
And testing. If testing's not widely available, people may have it, but they don't know it. And that's one of the things that this program would provide is testing.
Can you kind of take me through it? I have to bring you a needle to get a needle?
Traditionally, how those programs work, and we do not have the policies for that. Right now, I have sample policies from across the state, but I would like to bring in community partners to look through those and agree on that. So mental health, law enforcement, public health, the hospital and things like that to really come up with that, and then that would have to be brought before our board and approved. But traditionally, the first time someone visits a syringe exchange program, there is not a requirement to bring dirty needles for clean needles, because you want to introduce them to the program. As they participate in the program, you only give them a 1 week supply, so they do have to have an encounter with you on a weekly basis, which is good because that gives us the opportunity to provide testing and resources and possibly link them to treatment services. But the standard increases. By the third visit, it is a 1-for-1 exchange.
Now, Sarah, when we talked about this at our board meeting a year or two ago, we talked about truly an exchange.
And that is a
this court
possibility.
and
but-
this court and myself are under that impression that it would be truly an exchange.
Typically,
Otherwise, it's not going to pass.
well, evidence-based programming, the first time someone visits, they're just getting familiar with the program, and if you implement that, then it's not as successful as if the first time you visit, you introduce them to the program and provide them with that, and then the next
Oh,
time.
to get a comfort level is what you're trying
Right,
to say.
and then the next time, they only get, they have to bring at least 50%, then the third time they have to, it's a 1-for-1 exchange. And it just builds a little bit more credibility and trust between the client and the provider, but by the third visit, it is a 1-for-1 exchange.
And where have you seen this successfully? In Louisville, Indiana?
In Louisville, they're right
Oklahoma?
under a 1-for-1. So I think their current data right now is 0.7 to 1. So that's how they operate, and so over time, it really does get to the one. I mean, you're going to get to the 1-for-1 eventually.
But this eventually could take a year, could take 2 months? We don't know.
By the third visit, you put that in your standard operating guidelines that it is a 1-for-1. So by the third week, that participant participates with you, but it doesn't have to be that way. You can adopt the policies the way you need to. But traditionally, if you do that out of the gate at the first visit with the client, you're not going to have as successful of a
They're not going to
program.
come to you, what you're trying to say.
I understand, and you kind of learn them in.
Yeah.
You're putting the best bait on the hook to start off and hoping they bite.
But now, when somebody uses a needle like that, typically, how many uses do they get out of one needle?
One.
One. Okay.
That's what your goal is.
I know, but are they
Right now.
reuse them right now?
Right now, they're reusing them.
But over and over till the needle bends or?
Well, and it's also not only causing a problem with that, but it can cause ER admissions to go up. So healthcare spending goes up because when they use those needles over and over, they're dull and there's infections in the skin, there's collapsed veins, there's other secondary conditions that happen that increase our hospital and ER utilization.
How much do you truly think this is going to help the outbreak of hepatitis C, HIV?
These have been proven over and over since the 80s to significantly reduce the risk for HIV and hepatitis C outbreaks.
And actually, you'll never know if you don't have it.
Yeah.
I mean, you'll know you're not doing anything wrong, but then if you don't do it, then like you said, that guy at your K-Health seminar gave you, if you don't do it, you're behind the curveball. A-ball, they call it.
I went to that seminar and your friend was down there, spoke over in E-Town the day I came to that class over there. She reminds me of Loretta Lee.
Georgia Heights.
Yeah, and
Uh-huh.
there was a real good speaker at this conference, and he just said, all you county judges, he was pointing at all of us, and all you magistrates, you always said it wasn't in your county, it's not a problem. You pushed it to the side because it wasn't in your family, or you didn't know, you might have knew one person that did it. He said that he had a big chalkboard up there on it, he put nothing plus nothing equals nothing. He said, you gotta try something. He said, if you don't try something, you ain't gonna have nothing. And he said, all you county judges, all you magistrates have pushed it to the side for years. He said, it's here. It was in your back door then. It's in your back door now. It's just got a lot of mixed emotions about it. How's the funding come from this?
Can I say something?
Tammy?
I'm Tammy. I'm with the Nelson County Health Department, the clinical director. And we've had several people come in off the streets here in Nelson County asking for clean needles. And I've not been able to give those to them, and that's a really bad feeling because they get very frustrated. And one guy even told me, then I guess I'll just have to go use a dirty one. And out the door he went, and I felt really, really
Are they
bad.
at stable mind when they came to ask you for this needle?
Yes.
So they're not all messed up? Yeah, that concerns me
The
somewhat.
ones that have come in to ask seemed, like you or I. So
They
you
could
know,
drive, they're not gonna be on the highway endangering other people's lives. I'm just scared if we're giving something away, they're gonna be coming from everywhere.
No, I mean, they were of stable mind. I mean, I was able to talk to them, but then once I said I couldn't help them, they became very frustrated with that. And I also became very frustrated because I knew at that point they were gonna go out and pick up any dirty needle that they could find because they needed a needle.
What's a needle cost?
I don't know.
I mean, it's cents. When we buy them in bulk, it's not expensive, and I think that's included in here about the cost savings in
I said
providing
$3 to
needles
$5 or $3 to $7.
versus, having to treat one case of hepatitis C. I think that runs around $84,000 per person. So we're going to pay for this one way or the other. We can pay for it in the preventative side of it, or we can wait for people to actually become infected, and then eventually taxpayers are going to have to pay for the treatment of that too.
Just curious, what financially, what is the incentive for an underage drug user to come get a free needle? It just seems like it's a minuscule amount of money. What would you anticipate a monthly cost for needles for a drug user?
Can they go off the shelf and buy it too? I guess?
Of course, they can go to a TSC and buy syringes that are used on farms. They can go use diabetic needles that are sold for people that have diabetes. They can. I think the resources are probably limited, but I don't think that I don't think that's the only reason why they access syringe exchange programs. I was talking to the chief of police in E-Town, and he said, it makes a lot of sense to me that those that participate in these programs are 5 times more likely to enter into treatment because they've already accepted some form of responsibility when they start to participate in these programs. He said they've already realized that what they're doing is a danger to themselves and to the people around them. And so they've come to participate in this program, and you can kind of transition some of those individuals along. They're already at what we call a stage of change, where they've kind of accepted that this is probably not a very good thing for them. We're not going to reach 100% of the drug users, but the ones we reach, we can connect them with other services, which is another carrot. It's not just needles. We can connect them if they've lost their health, if they've lost their health insurance. We can connect them to people that can help them get that back. If they are interested in going to treatment, we can connect them with that. We can connect them to pregnancy testing, to testing for hepatitis C, testing to HIV. If they test positive for that, we can connect them to resources for treatment.
Is that at a cost? She couldn't give them a 50-cent needle, so
It's
how
not
are you going
legal.
to test
It's
them?
not legal for her to give them a needle. We have them.
Needles.
We have the ability to do that now, but until I get fiscal court to approve it in Bardstown City Council, it's not legal for me to do that.
And we need to start somewhere. I mean, these people have nothing, no resources
My experience with them in the office, dealing with the
the
families, because they've been in to talk, is that they've used up, the family has to cut them off somewhere along the line. And because they've wrecked their cars, they've gone through credit cards.
Stolen everything.
Yeah, and then they start breaking into houses and their families' garages and stealing stuff. And I've seen it more than one time.
Absolutely.
Then they're on the low end, and that's when they start doing stupid, more not so smart than dumber things.
How many people on a monthly basis do you think will use this program?
That's the tricky part of it. We don't know until we open it.
I mean, well, you've got plenty of data from other communities that are similar.
Isn't there
size, right?
plenty of people going to the Louisville Exchange?
We have data that shows that there are Nelson County residents going to the Louisville Needle Exchange. We also know that we've had people come in our clinics. We do think that they'll be utilized. Typically, they start out pretty slow. The best advertisement for that is word of mouth. We're estimating that when we first start this program, we'll probably only operate it 1 day a week until the demand grows to increase that. But it's tricky. It just depends on, there's variables to consider what type of relationships we establish in the community. If we approach it at a community level, it'll be more successful and probably more utilized. Where we locate it will be, indicative of whether people use it or not, if it protects their identities. There's different variables that go into utilization of it. So we really won't know it 100% until we try it.
If I was a druggie, I would not use this thing. I think personally. Number one, I'm opening up myself to law enforcement that I am a druggie. So why would I do that?
They're already
Most
protected.
druggies don't care. They don't care. Like you said, they steal from their family. They steal from everything. So they don't care.
I think it just depends on where they are in that cycle. So, kind of like what the chief was telling me, you know, a lot of the people that are going to participate in this, on some level, are progressing through the stages of change. At some level, they're ready for someone to assist them. We're not going to reach 100% of drug users.
No.
I agree. But those that,
But there is, would
but
be
we
a new
may,
resource
but we'll
available.
reach some of them, which is better than what we're doing now.
Well, I guess if we do pass this thing, we can try it with an experimental basis. If it's not working, you come back to us in a year and say, boys, I'm going to back up on this. I don't think it's a very productive program. Or you might come to us and say, thank you all for doing this. I
You
think
can give us a
we're-
report.
Absolutely,
Anybody
and we
else?
will be tracking data. We're required to track data for the state, for the Kentucky Department for Public Health, and they're required to report that to the legislators. So there is data, things like how many people went into treatment, how many syringes we gave out, how many we collected, how many positive hepatitis C's do we see, how many people were we able to get into treatment for that. There will be data that we'll track that will give us, you know, a good idea of what we're able to accomplish.
For the court, just for the record, Magistrate Sam Hutchins said he's in favor of this program after studying it, even though I couldn't get his proxy. But he did say if he was here, he would go forward.
I got a question for Jim. Jim, aren't you on this committee? And you do think, yeah, you do think it's,
Like I said last time when it came up, I'm not 100% on the solving a disease problem. You know, they passed it real quick at the Lincoln Trail meeting. The doctors all thought it was real good. You know, that's out of my area. But what I thought was a good thing was that the guys that don't care yet, that are hooked on it, and I don't know, I don't have that experience, but they're not going to use it. It's the ones that are so hooked on it and they know they're messed up, they're going to come somewhere and try to get help. This will help. It gives them
A new door.
They don't know, a lot of them probably don't know where to go to get help, but they got this exchange program, they can go to the facility, talk to these professionals and say, okay, you know, is there any way I can get help? You know, and that's what they want to do. I think that's the bigger benefit. That's what I look at as the bigger benefit than anything. It's on a looking at it looks like a kind of a silly, crazy thing to do, get needles out, but if it brings people that are really messed up in to get professional help, it probably is a good thing.
is there any data on that, sir? To where you have helped?
I asked that at that meeting. And she-
I mean, I haven't implemented the program, so I have no data, but
Yeah,
as
no
far
data in
as
our district.
on the national average, there is data that says that participants of this program are 5 times more likely to enter into treatment than those that do not participate in syringe exchange programs. So they are successful in it. But if you think about it, those clients are visiting us on a weekly basis. We see them every single week. So there's a relationship that's developed there. And so as they move through this process, it makes sense to me that we would be more successful than someone that never seeks assistance anywhere.
So your office has nothing to gain out of this, you're just doing it for the public health safety, is that correct?
That is absolutely 100% correct. I have only resources to you know, this will take funding and it will take staff from me. And
Internally, we'll move stuff around internally.
yeah, and I will.
You understand, the health department, and I'm going to interject here, I've been chairman of the board for 4 or 5 years. Health department's role in the communities have changed over the years. Not only from a provider of basic immunizations, but to education and other opportunities for a better healthy society. I'm trying to put that not in a...
One of our primary roles is to prevent disease in our communities. And so this is one of our primary missions.
These needles that you all give, these are single-use needles, right?
Mm-hmm. And we do give them a sharps container as well to keep that in. That's how they... Huh?
You cannot use them again.
It depends on which kind you buy. You can buy either or.
But you will probably be better to give out one you use just once, probably.
Yeah, it's more expensive, but yeah.
So they make a needle that you can only use one time?
You shoot it and it retracts back up in the, so that you can't, it's not sticking out.
Motion's been made.
I just, I think the potential for prevention of diseases and treatment for drug use far outweighs any of the concerns that I have about the exchange itself.
Any other comments before I?
Can I ask
call for a
one more
vote?
question? Joe, you're in this line. What's your opinion on this?
Well, I have to follow their lead. I mean, anything is better than nothing. Right now, we have.
That's what that guy told me down in nothing, plus nothing equals nothing.
So you gotta start with something. And see how you can build on that.
The sheriff's got a comment too.
Yeah,
Sure, sure.
although it hasn't happened on the books, these drug charges have been decriminalized, and approximately 50 people that my narcotics detective arrested last year, all of them together did less than 10 years behind bars. So these people, I mean, incarceration is not we're not there. Although in theory that would work, but that's not what we're doing. And so, I mean, if incarceration is on your mind and separating those people from society, that's not where
It's
we're
not
at
gonna
right
happen.
now.
It's not an answer.
Motion's been made and second. All approved, say aye. Disapprove, motion carries. Thank you,
Thank you,
Sheriff.
sir, Joe. Thank you, young lady, for
Are you out?
the knowledge.
I promise y'all won't have to see me around because I'm scared of needles.
Let's move on, Jerry. Thank you.